Hi, Gene Ransom here. I'm going to give 3 ideas to ensure physician viability while promoting public health. We've all been under pressure in physician practices during this COVID crisis. Obviously, some folks have been nervous about going to doctor's offices. We had a period of time where elective procedures were not allowed. There's been incredible pressure on the financial well-being of physician practices, and it's really important that we have a strong and vibrant physician community for the public health of Maryland. Also, patients are being put at risk because routine preventative care is being put off. And if we do that over a long period of time, more complex, expensive medical issues will occur in the future. So I've come up with 3 suggestions that you can consider during this period while we're in COVID to improve your practice, maybe make a little more money, but also to promote public health. So it's good for society, but it's also good for the economic well-being of your practice. All right. So number 1, maximize telehealth. Obviously, a lot of physician practices ran into telehealth when it suddenly became billable. However, really, this is the time as people start to return to your office to make sure that you are integrating it into your practice and using it correctly. I would suggest going on the MedChi website, www.medchi.org, and looking at all the great materials we have up there. We have a billing coding policy, which is open and free. So really look and make sure that you're maximizing the value of telehealth. Just because people are returning to your office doesn't mean that you can't continue to use telehealth for certain parts of your practice and continue to get paid for it as long as this goes forward. It's a good time to make sure that what you're doing now will be acceptable after the COVID flexibility goes away. It's important for you to think about how can you use this technology to really maximize gaps in your schedule. And I have an idea on that coming forward. So number 1, make sure you're maximizing the use of telehealth to improve your efficiency and get more billable visits in there. And I know a lot of you have implemented it and done it going forward, but this is an opportunity. Number 2, remote patient monitoring. CMS announced in January that they were going to pay for remote patient monitoring for Medicare patients. I think a lot of physicians haven't really been looking at RPM or remote patient monitoring as an opportunity. MedChi has a young lady, Andrea Mullen, on our team who can help you learn about different remote patient monitoring opportunities. And we really suggest that this could be an opportunity to improve the public health, but also bring in some additional money. So the way remote patient monitoring, without getting too much into billing and coding, and I'm going to do another video kind of going through that stuff, allows you to bill a per patient per month fee under Medicare to do remote patient monitoring through an app and other technology. So you then can bill for those services. This obviously can bring in new income into your practice and can be helpful, but this can be really valuable for your high risk or expected expensive patients or people who have disease states or issues that need to be monitored that maybe aren't as able to come into your practice under this COVID situation. Again, there's a lot of technology out there, a lot of people selling stuff. I would suggest being careful, going through a process. You can work with a medical society or work with someone else. Maybe, step into this slowly and figure it out, but it is a potential new source of revenue. And again, it is billable by CMS for Medicare starting in January 1 of 2020. So this is a relatively new thing. If you want to learn more, please reach out to MedChi and have a chat. The third thing is the annual wellness visits. Now, this is really nothing new at all, but it's a great opportunity, particularly for my primary care physicians. And while all physicians can bill it, if you're a specialist, I think you need to be careful to make sure that you're not stepping on anyone else's toes. But again, the annual wellness visit is a really valuable way to bring in additional revenue. One of the great things is CMS is allowing annual wellness visits to be done via telehealth. So this is a great way you can support physician income and improve public health. I would strongly, strongly encourage you to aggressively look at your schedule and see if you have slots and try to schedule, particularly your Medicare patients, for annual wellness visits and get them in there. This is terrific on a public health point of view because it really gets you that care management plan you need to improve the physician's well-being and plan, which is great from a public health point of view. And it's also good for you because it's a good way to kind of get some wellness visits done. I would suggest you can do these either in person or on telehealth, but it's a big opportunity. And again, if you want help on how to use that annual wellness visit as an opportunity to improve your practice, please reach out to MedChi. So the viability of your practice is a public health priority, but also some of these services that are not being done, like routine checkups, vaccinations, and other things not being done, are going to create a crisis for us. So we really want to make sure that you are able to be in practice. And whether you work in an employed setting or a private practice, we're willing to help you deal with the economic impact of COVID. Early on, we helped a lot of physician practices apply for grants. We helped hundreds of practices implement telehealth. This is important to us, is making sure you're able to practice medicine regardless of whether you're in private practice or employed somewhere. Having your employer able to bill and see patients for you is very important because obviously that keeps you employed. So we think this is a priority and we're focused on it. If you need anything or have questions, the website is www.medchi.org. And I want to thank you for taking the time to listen to me today. I'm Gene Ransom, CEO of MedChi, the Maryland State Medical Society.